The Expert Guide to Bulbous Nose Rhinoplasty. One of the most common complaints I hear from clients coming into my office is that they don't like the size or shape of their nose. The nose is the center of the face, and when it's out of proportion with the rest of the facial features, people naturally feel self-conscious about it. Otherwise beautiful features may go unappreciated because the eye tends to always be drawn to the prominence of a large nose. But when this is corrected, the effect on the overall appearance can be truly astounding. While noses come in all shapes and sizes, having a bulbous nose seems to be a special source of insecurity for people. If this is the case for you, a rhinoplasty to reduce and reshape your bulbous nose, here's a quick guide. What is a bulbous nose? A bulbous nose is a nose which has an enlarged or ill-defined tip. The problem with the appearance often is an imbalance between the upper and the lower halves of the nose. The eye usually likes a straight and uninterrupted, gently curving line between the head of the eyebrow and the nasal tip. When the tip is too wide in relation to the nasal bridge, disproportion and imbalance occurs. The gently curved line is interrupted. The cause of a bulbous nasal tip can be either enlarged or ill-defined nasal tip cartilages within the tip, or thick skin in the tip itself. In either case, both anatomical causes contribute to a lack of definition in the nasal tip. It is really important to diagnose the exact cause or causes of an amorphous or bulbous nasal tip, as a targeted surgical treatment is required in order to correct the problem. Fortunately, a bulbous nose can be fixed with rhinoplasty surgery. What is bulbous nose rhinoplasty? A bulbous nose rhinoplasty is a type of cosmetic surgery where the nose is reduced and reshaped to form more evenly with the rest of the facial features. During a bulbous nose rhinoplasty, a surgeon may use several different techniques to modify the nasal shape. Often, excess cartilage can be reduced or modified in order to create more definition, narrowing, in the nasal infrastructure. Special suturing techniques can be employed to create a sharper and more defined tip. If the cause of the wide and ill-defined tip is the nasal skin, on occasion, we actually have to even resect thick skin. Careful diagnosis is necessary to allow the surgeon to make an individualized surgical solution for this problem. Selecting the right surgeon for a bulbous nose rhinoplasty is really important because results should look beautiful but natural. Be sure to ask for before and after photographs from previous procedures your prospective surgeon has done so that you can assess their work on comparable patients. What is different about bulbous nose tip rhinoplasty? A bulbous nose rhinoplasty is a bit different than other types of nose jobs because the surgeon must not only reshape the nose, he or she may also need to remove excess skin and treat the skin with skin resurfacing to diminish the contribution of the skin to the nasal imbalance. A bulbous nose rhinoplasty may be performed with either an open or closed approach. In an open procedure, an incision is made across the strip of skin that divides the nostrils. This is called the columella. This gives the surgeon increased accessibility to problem areas that need to be worked on. In a closed procedure, the incisions are only made inside the nostrils, leaving no visible scars. Initial consultation, your surgeon will advise you about which method is best for you and what kind of results you can expect. Are there special bulbous nose rhinoplasty techniques? Yes, plastic surgery is an evolving field, rapidly evolving, and new techniques are being pioneered all the time. It is vital to find a surgeon who's up to date on the latest methods. In our practice, we take a very tailored approach to each individual and to each case, and we use a combination of specialized techniques to achieve the specific results the client is seeking. With a bulbous nose, sometimes we're able to remove excess skin and simply reshape the existing cartilage. In other cases, we use advanced suturing techniques to reposition the cartilage or small grafts to refine and define the tip. Rhinoplasty is far from a one-size-fits-all procedure, so we customize each procedure to the individual client. How much does bulbous nose rhinoplasty cost? The cost of a bulbous nose rhinoplasty varies a great deal. The extent of the work to be done, whether the surgery is open or closed, and whether it's a first-time procedure or a revision. It also actually varies on the location in the country where it's done. Generally speaking, patients can expect the total cost of a rhinoplasty, this includes the operative facility and the anesthesiologist, to range anywhere from $9,000 to $15,000. If the surgery is deemed medically necessary to correct a documented breathing problem, insurance may cover that portion of the procedure which is designed to correct nasal breathing. What is recovery like after bulbous nose rhinoplasty? We often hear from patients that rhinoplasty recovery was quicker and less painful than they anticipated. Just to be safe, you should plan on taking about 7 to 10 days off of work or regularly scheduled activities. The initial recovery period is about 1 to 2 weeks, with the cast and sutures being removed after about 7 days. While it may take up to a year for your nose to fully settle down and to make its new shape, almost all of the large swelling will have subsided within the first 3 months after surgery, and about 6 weeks for more strenuous activities, such as contact sports. What do you expect before and after bulbous nose rhinoplasty? The first step in getting a good result is the initial consultation. During that consultation, your surgeon will carefully examine you and your nasal structure and all your facial structures and have an in-depth conversation with you about what changes you would like and about what your ideal outcome is. Any reputable surgeon will take the time very carefully to listen to your goals and give you a detailed idea of the extent which they're able to achieve and what the limitations may be. They will try to maintain the functionality of your nose. Once you select a surgeon, and I fully encourage you to consult a few of them until you find the one that you feel good with, you will schedule a date for surgery. Your surgeon's office will go over preoperative instructions, including informing you of medicines and supplements to avoid, and will let you know what to expect following surgery and how to best care for yourself afterwards. You will need to fast for a certain amount of time the day before the procedure, as you will likely undergo general anesthesia or heavy sedation. This surgical procedure is often performed as an outpatient procedure, and this allows patients to go home the exact day of the surgery. Do I need a bulbous nose rhinoplasty plastic surgeon near me? While you may be able to find a qualified rhinoplasty surgeon in your area, it is not at all uncommon for patients to travel for the surgery in order to ensure that they get the very best outcome. We're proud to say that we get clients from all around the world coming to my office in both Beverly Hills and in Sacramento. This is done both for revision surgery and for first-time rhinoplasty. Please feel free to give us a call. I'd love to speak with you. If you have questions? We help people every day like yourself. Email us at hello@sykesplasticsurgery.com. Thanks a lot for watching, and I hope to see you in my office.